Hello, my name's Kate Butler and I'm here representing two organisations. One is an employed massage therapist at the Austin Hospital in Melbourne, Victoria, and as the Victorian Coordinator of Oncology Massage Training Australia. Today I'll be talking about the massage service at the Austin Hospital. And to start with, I'd like you to picture this, if you will. Arriving to work at the hospital in the morning, I look through the list of patients who are booked for massage in the wellness centre for the afternoon. There's a man there whose name I recognise. He has an advanced brain tumour. Some weeks back, his wife and he attended one of the courses I run for carers who want to learn how to safely massage their loved ones. I'll never forget her face. She had good hands and had clearly been touching him a lot and with great tenderness throughout his disease process, and it was really easy for me to guide her. Most of the time when he was receiving massage from her, his eyes were closed. Whenever he opened his eyes, he sought out her gaze, and whenever their eyes met, she was smiling at him. Their intimacy was palpable. And whenever he again closed his eyes, hers were full of pain. He doesn't have long to live. On this particular afternoon, he comes to see me for a massage. He's now in a wheelchair. His wife wheels him in. His face is moon-shaped from steroids. His speech is affected and his words are hard to decipher. His head and arm movements are stiffened and stilted from anti-epileptic medication. He's lost all feeling down the left side of his body. He tells me he has lower back pain from spending all this time in the wheelchair. He's deteriorated even in the few weeks since I last saw him. I position him in the wheelchair in front of the massage table, adjust the height, put a couple of pillows in front of him and ask him to lean forward slightly so I can access his lower back. And in the awkward moments that follow, it becomes clear that I'm asking too much. He can no longer lean forward. I feel the pressure to transition from plan A to some other plan I have to come up with in the seconds that follow, while somehow maintaining his human dignity and my own professionalism. What am I going to do? So I'll come back to that story later. Currently, there's significant national investment in new or refurbished cancer centres around the country with an interest in complementary therapies. But the challenges remain mostly in how to fund them and then how to implement them. The challenges in getting massage approved are multiple and include the lack of scientific evidence available, language barriers such as complementary and alternative therapies, those two words are often lumped together, the difficulty in having the capacity to effectively credential practitioners, and the inconsistency of qualifications within the massage industry. And also the challenge of tackling preconceived perceptions of what massage therapy is. By the year 2000, the Austin Hospital in Melbourne was one of the largest cancer centres in Victoria. But there was a great need to create a purpose-built cancer centre. In 2008, construction began, including a refurbishment of what is now called the Wellness Centre. This is located within the hospital and it offers a range of evidence-based services such as support groups, carers support and lifestyle programs, meditation classes, counselling, music therapy, art therapy, acupuncture, yoga and oncology massage. Olivia Newton-John agreed to be involved on the provision that the aspect of wellness would be a key new part of the centre. All complementary therapies and programs are philanthropically funded and all massages are free of charge. Massage was on the top of the list of patients' choice for complementary therapy and it has a reasonable evidence base. There was a need to minimise risk through excellence in service provision and a desire to provide a service of the highest possible standard. There was also a desire for the massage service to be fully integrated into all the clinical areas of the hospital, So we currently work with both outpatients and inpatients on all of the wards, including the palliative care unit. A systematic review found that massage consistently reduced depression and anxiety, as well as helping to lower pain and nausea. Clinical guidelines developed by the Society of Integrative Oncology conclude that serious adverse events in massage are rare and are, quote, associated with untrained or inexperienced practitioners, unquote. The guidelines go on to say that for cancer patients experiencing anxiety or pain, massage therapy delivered by an oncology-trained massage therapist is recommended as part of multimodality treatment. That comes from research conducted by Deng and Associates in 2009. The Austin heard about the work of Eleanor Oyston, who's the founder of Oncology Massage Training. Eleanor's quest was to dispel the myth that massage can spread cancer, and her training programs equip therapists with the scientific knowledge to explain why gentle touch works in the reduction of a range of distressing symptoms that accompany the disease and its treatment. The training is a unique combination of head, or the science, and heart, compassion, and the Austin recognised in Eleanor a quality of training program and deliverance that is equal to world's best practice. The hospital-based training began at the Austin in 2012, and in that same year I became the first massage therapist employed by a public hospital in Australia. Due to the success of the training and the service, there have been 12 massage programs hosted at the Austin since then, with 64 graduates, and there are now 3 massage therapists employed delivering massage in all the clinical areas of the hospital. Thinking back, there are so many details involved in establishing a new service. In the chemotherapy unit, I made an effort to get to know each of the nurses. I was, after all, a new kid on their block, bringing a new skill they knew nothing about. When you mention the word massage, most people think of kneading and pummeling, the no pain, no gain philosophy. That's the culture we've created, and it has required constant explanations to educate both patients and staff that this is gentle touch, touch that is appropriate for people in vulnerable situations, and that this form of gentle touch can be extremely powerful if delivered skillfully and mindfully. After receiving a massage in the wellness centre, a patient recently said to me, "That was gentle and that was profound. I don't understand how you can get profound from something so gentle." Any doubts or fears held by staff about the service were allayed in time by the feedback from the patients. One man said, "I never thought I'd look forward to coming in for chemo." The opportunity to have a positive and enjoyable experience within the challenges of diagnosis, treatment, recovery and/or palliation makes caring for that patient easier, and soon when I appeared, it became difficult to keep up with nurses' requests for their patients to receive massage. In order for a service to be fully integrated, it must be endorsed from the top down. On one occasion, we were running a Module 4 training week, and in those weeks I'm employed not by Austin Health but by Oncology Massage Training. So when an urgent request came through from the head oncologist for a patient to receive massage, it was not without some conflict of interest. But after some deliberation, we chose to respond. I went to the wellness centre to meet the patient. She was extremely anxious, hysterical, beside herself at the thought of having her CT scan. It was an emotional cocktail of anticipatory claustrophobia associated with entering the machine, anxiety about what the CT would reveal, and in between sobs, a heap of issues relating to family abuse, current crises and financial challenges. But she'd needed scans before, and usually an anaesthetist was called in to sedate her. But on this occasion the anaesthetist was unavailable. I told her to take a deep breath, mostly in order to arrest her hyperactivity. I instructed her to remove her shoes and get onto the table fully clothed in the position in which she would sleep. These instructions seemed to quieten her. I covered her with a blanket. For the next 35 minutes, I stroked her back in a slow, deliberate, predictable, repetitive pattern. Her sobbing subsided, her breathing slowed down. She dozed in a half-waking, half-sleeping state. She was exhausted. I left her asleep and in the care of a hospital volunteer. I heard later that her CT scan was performed without issue. I wondered about the comparative cost of a nurse, an anaesthetist, and the drugs needed to calm her compared to 40 minutes of my time. The Olivia Newton-John Cancer and Wellness Centre has 3 wards dedicated to oncology. Level 6 includes gastrointestinal, genitourinary, breast, thyroid and endocrine tumour streams. Level 7 includes haematology, lung, head and neck, melanoma and skin, gynecological, central nervous system, bone and soft tissue. Patients with haematological cancers are often immune compromised, and one section of level 7 is inside an area that is separated. Each individual room is positively pressurised. Level 8, which has the most stunning views across the city, is the palliative care unit. The only patients we cannot touch are those who are receiving radioactive treatment for thyroid cancer. There may be 1 or 2 at most. Everyone else, including those with low white cell counts and compromised immunity, including those with bacterial infections that are resistant to treatment, including those that are extremely frail and in the final stages of life, is able to receive touch. On occasion, we've been privileged to be present at the time of death and can impart peace to both patient and family in such times. One woman in palliative care said, "I just want to die having massage." Talk is a starting point, but it's been our experience that the true integration of the service only happens when staff witness the benefits in the patients themselves. I began this presentation with the man with the brain tumour in a wheelchair, unable to lean forward, and I'm wondering what I'm going to do next. I crouch down beside the wheelchair and slide a hand in behind his lower back, and I wait, partly to figure out what else might be available to me here, and partly because there's a shift taking place in the atmosphere of the room. Something's happening here. His eyes are closed, his breathing deepens, and in the stillness he starts to tell me about his past. He suffered from chronic depression as a young man and well into his married years and as a father. It was a battle which, despite available treatments at the time, plagued him and affected his family and relationships. One day he met a personal trainer who said to him, "We've got to get this anger out of your body." And over the next few years, and with considerable hard work, he was free of it. While he told me this story, he paused often to let the tears flow. He told me how grateful he was to have lived and loved. I left my hands on his shoulders and didn't move or speak. We both wept. Time seemed to slow down, and eventually, when the time came to go, I wheeled him out to his waiting wife. Their hands joined and he smiled up at her with joy. He turned to me and said, "Isn't it great to feel connected?" It's moments like these that make this work unquestionably worthwhile and fulfilling.